Can start now.
ಮಾಡಿದ್ದು ನೀನು ಹೋಗಿರು Good afternoon, everyone. Myself, Dr. Sri Shailesh. I'm currently working in Apollo Cradle Koramangala as a lead consultant in a pediatrician and a neurologist. Today, I'll be discussing about the common problems in the newborn, which is a very important topic with respect to the newborn parents. What are the most common problems are like crying, jaundice, skin-related issues, such as coughing, nappy rashes, loose motions, and there are many more. So, first coming to the crying. Crying is the most common problems you see in our day-to-day practices. The most common causes for the crying may be because of the feeding, or baby may needs a cuddling, or maybe a time of a nappy change. It may be a natural demanding signal. One should assess feeding or cuddling or a nappy change. Let's consider baby is crying and baby was fed well and subsequently crying stops, or cuddling subsides crying, or changing of the nappies. If it cries has stopped, then it's all everything is fine. If a baby cries continuously and extruding crying, it's unconsolable, then other causes comes in the picture, such as could be a nose block, ear pain, diaper rashes, which really cause an extruding pain in a babies, and the most common will be the colic pain. This is an abdominal pains. So if a baby is crying continuously unconsolable, then these are other causes has to be kept in mind. The next, the most common will be the jaundice. So every baby will have a jaundice. Jaundice appears as a yellow discoloration of the skin and the eyes. Why the babies will develop a jaundice? As a baby is born, baby has a fetal RBCs which dies and which forms adult RBCs. This is a normal phenomena, and and whenever the fetal RBCs die or splits, which releases a jaundice, which is called as a bilirubin. The load of the bilirubin in the newborn is much higher, and which will not be withstood with a liver. The liver is a bit immature. Because of that, you will see a yellowish discoloration of the skin as well as the eyes. Some babies will have more jaundice, some babies will have a lesser jaundice. There are many causes to have a higher jaundice that I'll not discuss much. Whenever you see a yellow discoloration of the skin or eyes, it's better to meet a pediatrician. He will check. Sometimes may require a blood test. It's called serum bilirubin levels. If it comes into a phototherapy range, then baby will be admitted and kept under the blue lights. If the baby is the levels are below the phototherapy range, it doesn't require the phototherapy or any treatment, and just giving a feeding itself can reduce the jaundice. But the important thing is baby has to be followed up in another few days, because first 10 days where the jaundice fluctuates. First, usually the jaundice starts at on the second day and it peaks by the 5th to 7th day. So 5th to 7th day, the follow-up is very important in all the babies. And how to treat the jaundice? As I told you, it's a phototherapy if it is admitted, and one can reduce the jaundice at home, also giving a good amount of feeds. Many parents ask about the keeping baby in the sunlight. Now, keeping baby in the sunlight is completely disproved. It doesn't help. Rather, it may cause sunburns or a dehydration. This is something which is very bad for the baby. And dehydration itself can lead to an increase in the jaundice. It's always a feeding reduces the jaundice. Keeping hydration reduces the jaundice. Coming to the next problem is the coughing. Babies will cough. Occasional coughs you'll see. Sometimes it could be a normal, sometimes it could be an abnormal. Normal, usually the babies will cough 3 to 4 times, especially when the feeding. because of the gush of the milk, which may touches to the posterior part of the throat, and which itself lead to a cough reflexes. Eventually, this will decreases as the baby grows. Baby get adjusted to the gush of the milk. Sometimes the coughing may be very severe, where baby will be continuously coughing, which also associated. It may also associate with breathing difficulties such as increased workout breathing, increased respiratory rates, usage of the external muscles. Whenever you see such kind of things, immediately you have to visit a local pediatrician. Next, coming to the skin-related rashes, skin-related issues. The most common skin-related issues are rashes, reddish rashes all over the body. These are normal. Usually, babies will tend to develop a dermatitis, and these are eventually disappear by 2 to 3 weeks. Small white rashes you will see on the tip of the nose. These are also normal, and this disappear by day 20, and most of the rashes are very normal. Eventually, as the baby grows, it will disappears. Some rashes you will see on the cheeks, especially after the 1 month, which is small, multiple, and hard to touch or rough to touch. And these are called neonatal acne. Cause is not known, but this also is a benign and which will disappear by usually by 3 months. Doesn't require any specific medications for the rashes. Don't apply any medications. Doesn't require any powders. Talcum powders are contraindicated in newborns. Coming to the nappy rash is one of the most common thing. The most common cause being the wetness of the area. Initial first 1 month, they tend to develop rashes because babies have watery motions. They pass multiple times. It may go up to 10 to 15 times, which is pretty normal. After the 1 month, the frequency reduces and rashes also reduces. Whenever you see a rashes, don't use a wipes, don't rub that area. You may peel it. Always pour a water and tap it. Rubbing definitely worsens the rashes. Don't apply any moisturizers or coconut oil. Many parents apply coconut oil, but rather it worsen. The ideal is keep that area dry and always apply raspberry creams and don't use the wipes when there is a rashes. Once the rashes has disappeared, one can use the wipes. Next is the colic pain. Colic pain, most of the babies will experience. These are normal. Usually occurs because of the flatulence or gas in the intestines, and it can lead to spasmodic contractions. And immature intestine itself can lead to contractions. First 3 months is are very common. Usually, baby cries exuding, starts in the evening time. Throughout the night, it may cry, and daytime they're pretty fine. Sometimes they flexes the legs over the tummy. The colicky pains are the exclusion of other criteria. Like you have to rule out the ear pain, any rashes, then you will label them as a colicky pains. Colic pain can be treated very easily with an anticolic medicine. There are something called as a colicate, which is preferably given before the feeds. And again, it's a benign thing, and eventually it disappears by 2 to 3 months. And the colicky pain is always you'll exclude other the causes of the cry, and then you label them as a colicky pains. Next, coming to the cradle cap. Cradle cap is just a scaly lesions over the scalp. Again, the cause is not known, and which is absolutely is normal in the babies. Some babies will have this, and eventually disappears by 9 to 12 months. Sometimes you may see a bit of itchiness, and no specific medication is required. If the cradle cap turns into a fungal infection, then only it's required the antifungal shampoos or the creams. It's absolutely is a benign thing. Many parents they try to peel the cradle caps, but peeling of the cradle cap can lead to a scalp injuries, bleeding, and sometimes it may lead to an ulcers also. So ideally, just leave it. It falls by itself. Sometimes you may see hair fall. These are all temporary hairs, and eventually baby will develop a permanent hair which is thicker and which is permanent, and you will see it around 9 to 12 months. Cradle cap on and off, you will see it, but it disappears by 9 to 12 months. Next, coming to the breast nodules, newborns can have a hard breast. These are nothing but milk collection. This is normal. Again, mainly occurs because of the mother hormone is transferred to the baby, and all female features are seen on the babies. So it eventually disappears by 20 days. Many people they squeeze the breast and they take out the milk. this may lead to an rupture of the ducts and leads to the abscess formation, which require an ICU admissions, and sometimes surgical intervention may require, and IV antibiotics is required for the prolonged days. So ideally, just leave it, no need to squeeze, and it will disappear by itself. And again, the hormone related, again, one more thing is the vaginal bleedings. Some female child can have a vaginal bleedings, and which is a very minute thing. Just use the wipes and clean it. It's not something which is to worry. It's just a hormone related, and it will eventually disappear by 1 to 2 weeks. So the most common things are the crying, jaundice, and the colicky pains. Almost all the problems which is related to the newborns is a benign. Eventually, it will disappears. Anything which looks very abnormal, especially with related to the breathing pattern, or if a baby is not active, or skin discoloration, especially which is related to the bluish discoloration, immediately have to rush to the hospital. Those are the emergency signs. And if a baby is active, and these rashes or loose motions, sometimes you can hear the noisy breathing because of the narrow nostrils, narrow pathways, or a nose blockade. These are all absolutely normal. Noisy breathing also sometimes it may be connected to the lungs, which is appears like as if the child has a congestion. It has a breathing. It appears like it has a breathing difficulty, but this is absolutely normal. This also eventually disappears as the baby grows. Usually, you see till 6 to 9 months, and it will be intermittent. So these are the major common the problems you do see in newborns, but almost all the problems are benign, and it will disappear as the baby grows. No specific medication is required. Only the symptomatic therapies will help you to reduce the problems. Thank you. I'll take over all the questions.